So why don't more men go to therapy? I'm a therapist, so it's something I'm very curious about. So today is part one of me reviewing the MOA Podcast episode called Why Men Avoid Therapy. So there are some things he is definitely right about, but some things are really off, and I'd like to address those things. This episode starts out pretty strong with this comment by the podcast host, Michael Sarton. So let's go ahead and take a look.
I would love to go to therapy if there was a therapist who I believe could keep up with me. I have accomplished things in my life. Have you? And you're going to tell me that I need to do these things. Well, hold on now. I have a family that depends on me.
He says, I would love to go to therapy if there was a therapist who I believed could keep up with me. I've accomplished a lot of things in my life, and I have a family to feed.
The problem is what's happened to therapy. So the issue is, under the age of 30, only 5% of therapists are men. And I believe what's happened is therapy has become a way to transpose, in some ways, woke ideology to men. It is.
Then he goes on to say that most therapists are women, which that's true. Overall, I believe it's about 75% of women are therapists. We definitely need more male therapists. The 5% being under age 30, I didn't know about that, but it sounds about right. I'm really not sure what he means here when he says if they could keep up with me. When somebody comes to me for therapy, I don't feel like I'm ever in competition to keep up with them. I don't usually talk about myself at all unless it's relevant to the conversation. Licensed therapists don't talk about themselves or their wealth or their properties, if we have any. But I think what he's referring to here is that he feels like he's a successful and accomplished man. So what could anybody tell him that could make his life any better? At least I think that's what he means here. If you have any other interpretation that's different, just let me know. So to that, I would say if he were to go to therapy, it would probably be for a specific issue. Maybe if he was let's say in a major car accident and started to have panic attacks, he might go to a therapist to learn how to reduce his panic attacks or eliminate them. Or maybe if he had an issue that he didn't feel like discussing with his family or friends, something that he wanted to be more confidential, he might want to go to a therapist to talk about that, because everything we talk about in therapy is confidential. It should never be a therapist telling somebody what they should be doing with their life. I want to make sure that's clear. That's a big no-no in therapy. Let's just keep watching.
There's some really good therapists out there, but for me, I would have to find someone who's kind of in the same cohort as me, either prior military or even a girl who understands the scene, or something that somebody who can kind of understand my ideology. Because I will tell you, there's a very big difference between a guy just living his life being 46 and a dude with testosterone.
So he says here that he would want a therapist who understands his ideology, or somebody with prior military experience. And yeah, I get that for sure. There are therapists out there who would fit the bill for those things. I can understand wanting a therapist who's had certain life experiences and who has certain traits. I specifically looked for a black female therapist for myself because I have black kids, and I wanted some feedback from a therapist who understands what it's like to be a black female in America.
I've heard horror stories from guys going to therapy and they're being judged by their therapist. It's like, you're dating multiple women at once? It's because you're a narcissist. That's why you're doing it. It's like, what the is that's what I'm talking about, right? You have, as a man, there's a period in your life if you want to date multiple women, you can. And there's a period of life if you want to settle down, you can, and you shouldn't be guilted for not wanting to do one thing or the other. So what I found is that therapy tends to be more, every instance that I've heard of, tends to be more like the feminization of men. And so that's the reason why I think a lot of men are complaining. What do you think?
Yes, so that is true. As a therapist, we are not supposed to judge anybody's lifestyle. The most important characteristics of a good therapist are that they are non-judgmental, have accurate empathy, and unconditional positive regard, which means we always see the client in a positive light. We always think the best of the person. It is my job to remain neutral and focus on what it is that you want to achieve in your life. So if you are a 25-year-old male and you come to me to say that you're seeing 3 women and you don't want to settle down, then I would just ask more non-judgmental questions, because I actually don't judge anybody for that. I would maybe ask if you're having safe sex and ask if you're being honest with all the partners, just out of curiosity. But If you weren't, I wouldn't judge that either. I would just ask a lot of questions, then we'd talk about other things that you feel like are a problem and see what you want to change about your life.
Now, the way we do therapy is it begins and ends from the female experience. The reason why guys are supposed to go to therapy in the first place is to get in touch with their feelings and to be more vulnerable. And so, I mean, we can run down this laundry list of like, this is what you ought to do. At the bottom of that list, it's the equation reads out to be more like a woman. That's what it comes to. Emote like a woman, talk like a woman, communicate like a woman, experience life like a woman.
I'm going to stop right there. So I want to say that there are a lot of men that come to therapy that tell me they do want to be in touch more with their feelings. They say maybe they feel numb and they don't know how to express themselves well. Some will say they do want to work on communication skills. But if that's not the man's goal for therapy, then we don't work on that. Like I said, it's your therapy, so you get to decide what you want to work on. I used to run a men's drug rehab program for 4 years, and I never felt like the goal was to feminize them. We used the cognitive behavioral therapy model, which was created by men, first Aaron Beck and then Albert Ellis. So overall, I'm just feeling like these men on this podcast, they've had some bad experiences with therapists, or they've heard about other people who have had bad experiences, or they're only seeing it one-sided, or maybe making some assumptions about what they think it would be like. I don't know. I mean, there are some not so great therapists out there, so you do want to be careful about who you choose and interview them first. But a good therapist is supposed to be non-judgmental, and you get to choose the goals that you want to work on in therapy.
Just because he didn't cry at the end of Titanic doesn't mean he's emotionally stunted, okay? He might cry at the end of Saving Private Ryan, but he's not going to he's not going to cry when Rose drops the heart of the sea down to the bottom of the ocean.
Because it was stupid. She could have let Leonardo.
Yeah, I mean, that's funny. So he's definitely right about that. A man's not emotionally stunted if he didn't cry at the end of Titanic. Men and women are different in many ways, and especially in couples therapy, we try to teach this to heterosexual couples so they can learn this. Men really like to feel respected by their wives and appreciated. They like to feel desired. And women like to know they're being heard, and they like to connect emotionally, along with other things. So, and a good couples therapist knows this and supports the couple with learning about each other's different needs.
Blocks in their life, right? Like mental blocks, and they're not going to be able to move forward or push through it without direction.
Yes. The difference is, I think there's a lot of men who have those mental blocks who go to Marine Corps boot camp or go to the gym, and then the mental blocks go away. That's the difference. There's a lot of these guys who have these blocks, and then all of a sudden they become successful, and a lot of the blocks go away. I'm not saying...
So I would not say that these blocks go away from them going to boot camp or going to the gym. Now, it is possible that men can gain a lot of confidence from going to the gym or a boot camp. They definitely can find a sense of purpose and a sense of meaning, which is what everybody needs, even women. But some people can use the gym as an avoidance strategy to suppress issues that they just don't want to deal with. That has come up. The reason I'm saying this is because I see it firsthand.
And all of a sudden they become successful, and a lot of the blocks go away. I'm not saying therapy is unnecessary. I'm just saying the way it's used for men is incorrect. They're taking the tool that they use for women, and then they're applying the same tool to the male psyche, not admitting that the male psyche is different from the female psyche. Again, a male therapist is called a performance coach.
So this is just not true. A male therapist is not called a performance coach. I want to add that most of the therapies that we use today, cognitive behavioral therapy and ACT therapy, which stands for acceptance and commitment therapy, and internal family systems, these are all interventions that were created by men. There are definitely interventions created by women like DBT therapy and EMDR, but a lot of the main interventions that we use in therapy were created by men. So these aren't just therapies for women. And in fact, EMDR is great for people who don't feel like talking about their trauma. So we don't talk about feelings in EMDR therapy. So if you're a man and you don't want to talk about your feelings, you can look for an EMDR therapist. So I'm just going to stop right here for the day and finish this later in part 2. Thanks so much for watching.